title of my paper was Vascular Surgery of the Carotid Artery Occluded Endarterectomy. Carotid artery disease is a process where plaque builds in the artery, causing a decreased blood flow to the brain. This is an increased risk of stroke, so it is a major problem. The causes of this can be hypertension, hyperlipidemia, diabetes, family history. If you smoke, you're at an increased risk. And some of the options that you can do for this are to change your diet, exercise more. You can take medication to control some of the risk factors. You can then get stents or endarterectomies if it is severe enough. My case was over a 67-year-old male who has had previous arterial problems. He had his carotid endart in 2010 at an outside facility. He has a bypass graft, an aorta bifem. He's had a TIA. He's been a diabetic since childhood. He takes medication for hypertension and hyperlipidemia. When he came to us, he had 4 tests. He had an aorta, which revealed a patent graft. He had an ABI, which was mildly abnormal. He had a lower extremity arterial duplex, which had stenosis on both sides. He had a carotid artery duplex, and that showed an occlusion on the left and a greater than 70% stenosis on the right. He had elevated ECAs on both sides with aliasing. The carotid endart showed hyperechoic intraluminal ICA contact, and it didn't have any blood flow, and it didn't have any spectral Doppler. And he had antegrade vertebrals on both sides. His medical history is likely what has caused all of his arterial problems as well as his carotid problems. An endart is meant to reconstitute flow back to the brain and to decrease the risk of stroke. It is a strong solution but not always a cure. There is a small chance that it could stenose or become occluded again, which is why testing should be done every 6 months to a year to double check stents or endarts in the carotid arteries, as well as really any other part of the body. Majority of the time there are no complications, but because there is a risk, it should be checked. Due to his risk factors, it is likely what has caused his diseases. He tried the lifestyle changes. He's on medication for hypertension, hyperlipidemia, so he had explored all his options at the point that he had the endart, and because of his because of the inclusion, he's at an increased risk for stroke. Plus, he has a greater than 70 on this side, and he's had a TIA. So he should be very aware of any stroke symptoms or anything that could happen. And no further surgery will likely be done because he is occluded. So it's hard to say what could be done for him.